And of course, we've been sharing stories of the doctors and the nurses who are on the front line fighting this virus while actually putting their own health on the line. And that's why our next guest is facing a very, very difficult decision. Dr. Laura Dean is a resident physician who works in the ER, both at Massachusetts General and Brigham and Women's Hospital, and she is 9 months pregnant. Recently began working from home in Boston, and that's where she's joining us now. Dr. Dean, good morning. How are you feeling?
Good morning, Al. I'm doing okay here. Countdown to baby is 4 weeks.
Wow. Just to be clear, we don't know right now. The best medicine doesn't say that you are more likely at risk with the coronavirus, but you're taking extra precautions, correct?
That's right, Al. There's really very limited data about pregnancy and COVID, both for the risk to the mom and also any potential risk to the newborn baby. I'm incredibly privileged to be in a position that I had colleagues and supervisors who supported the notion that if there's any risk, it's not worth the risk right now for the baby coming so soon. So I've been in a position to be able to step back from directly seeing patients myself.
And as far as there must be a certain frustration level. I know you've been working from home, but you want to be there with your colleagues. How difficult is this?
This is an incredibly difficult time for everybody. Lots of hard decisions for people keeping themselves and their families safe. And for me, particularly challenging between balancing my responsibility to my patients, to my colleagues, my responsibility to my job, what I signed up for. This is what we trained to be able to do, and balancing that against the health and safety of my family and protecting my baby.
Dr. Dean, Craig Melvin here. What was it like when you were there last week and the week before, being 9 months pregnant on the front lines fighting this virus? Were you afraid at all?
Yeah, every day I was scared to go to work. And I'm sympathetic with everybody who is still out there working right now, from the janitors to the nurses to the physicians who show up to work every day. They're incredibly brave. I was scared to go to work every day. And that's the reality right now. You don't know who's carrying the virus, what risk it might pose to you. And this is a time of a lot of uncertainty. And it was really challenging to be in a work environment where anybody you might talk to or touch could pose a risk to your own health.
You mentioned babies coming in 4 weeks. If you don't mind me asking, boy or girl, and how are the preps coming?
We're having a little boy. We just got furniture in the nursery. We've got a big tree decal up on the wall. All that remains to be seen is what we're going to name him.
All right. Dr. Dean, thank you. Congratulations, by the way. Congrats. We need uplifting stories like this. So life coming into the world is uplifting. We wish you and your family the best.